Hello there. My name's Sarah. Let's just check your wristband. Perfect. Okay. I'm doing some rounds at the moment to help out because we're a little understaffed. Okay, I'm actually a consultant surgeon. Okay. But I will be looking after you based on the symptoms that you've presented with when you came into hospital. Okay, so I'm going to do some checks on you today and just take a little look at the notes that have been written from your admission. Okay, but now we've got you in this ward, I can do some further checks if that's okay. Alright, so how are you feeling at the moment? Okay, so a little bit warm. Okay. How is your pain level at the moment? Okay, let me just check. Yeah, you've been prescribed some pain meds about an hour ago, so you won't need those topping up just yet, but someone will be along to give you some more later. Okay, so let me just check. So you've been admitted with abdominal pain, upper abdominal pain, right shoulder blade pain. Okay. Feeling warm, some nausea. Okay. And it's not the first time this has happened. Alright, okay. Right. So, when did the pain start? Right, yeah, okay. And you've had this before. When you had it before, was it similar? Not quite as bad as this. Okay. Alright, my lovely. You've been given some anti-nausea medication, so hopefully that will kick in soon. Okay. So what I'd like to do, if that's okay, is just do some checks over you. Now, I will be having a little palpate around the abdomen, okay, at some point. Is that alright? I know it's very tender at the moment, but I do need to have a feel around. And what's going to happen is when I've done my checks and I've run a blood test, okay, I'm going to take some bloods from you if that's alright, okay, and I know I've got a urine sample from you on the side. I can see that because I know they asked you to do a urine sample, which is wonderful, so I'll check that as well. Okay, but then I'd like to get you for a scan, an ultrasound scan later today. Okay, and then if surgery is required, then I have scheduled you for tomorrow. Alright, I think it is your gallbladder, which is what you were diagnosed with last time, but it may well be that we need to take that gallbladder out if it's getting too inflamed and making you too poorly. We can't leave that too long. Alright, my lovely. Okay. So have you got any questions at the moment? Alright. Well, we've got the ward to ourselves at the moment, which is good. Okay, so firstly, I'm just going to take your temperature. Alright, I'm just going to pop this thermometer into your ear. Okay, nice and gently. Okay. Alright. You're a little bit warm, okay. Yeah, I've got a slight fever there. Okay. Right. Just going to take a little listen to your chest, if I may. Okay. Just warm this up a little bit. Okay. Tell me if anything feels uncomfortable at any point, won't you? Okay. Right then, I'm just going to press that there. Just breathe normally for me, my lovely, thank you. Alright. Okay, I'm just going to place the stethoscope on your neck. Keep keep breathing normally for me. That's wonderful. Okay, now I'd like you just to take some deep breaths in, okay? So, okay, keep doing that every time I move the stethoscope. So, in and out, okay. Okay, I'm just going to pop round the back a little bit. Keep breathing in and out. It can make you feel a little bit dizzy, alright, but I'll be very quick. Okay, in and out. In and out. In and out. Wonderful. In and out. Okay, that's fine. So I'm now going to take your blood pressure. Okay. Just going to pop this cuff around your arm. There we go. Is that okay for you? Good, good. It's nice they've got you sitting in your chair anyway. Are you comfortable in the chair? Because you can get back into bed if you like. Okay, that's good. Okay. So, I'm just going to pop the stethoscope into the crease of your arm, onto the brachial artery there. And I'm going to inflate the cuff. Okay. It will go tight for a little while. Okay. Okay. I'm just going to try it on your right arm. Alright, I like to do both sides. Okay, so just pop that on there. Okay. Pop the stethoscope on. Alright. Got a runaway stethoscope there. Okay. And just going to inflate that now, okay? Just breathe normally. Get that off there. Okay. Okay, pop that down there. Don't need that. And don't need those again for now. Let me just make a note of your blood pressure there. Okay. Right. I'd just like to take a little look into your throat. Okay. Could you just open nice and wide for me? I'm just going to shine a little light into your throat. Alright? Just going to depress the tongue. That's wonderful. Let me know if you feel really nauseous while I do this, okay? Don't want to make you feel any worse, but I'm just going to have a little look in there. Okay, can you say "ah" for me? Your throat isn't sore at all, is it? Okay. Have you been getting any sore acid reflux type throats? A little bit? Okay. Could you just pop your tongue to the roof of your mouth for me? Thank you. got my light, I'll just have a little look in your eyes if I may. Okay, let me just... open those a little bit. Okay, just have a little feel of those lymph nodes. Just down your neck at first. Okay, just behind your head a little bit. Anything feel tender? No, that's good. Okay, just the pre-auricular, post-auricular. Okay, the submandibular. Okay, and clavicular. Okay. All right. Just relax there. Okay. All right. So I will want to take a little look at your ears, if that's okay, in a second. But firstly, I'm just going to have a little look at your nose. Okay. Very gently insert the otoscope into your nostril. Okay, that's fine. Okay. You can sneeze now if you want to. Okay, that's perfect. Just chop that down. And very quickly, I just want to take your oxygen sat. So if you just give me your finger, okay, in this hand here, I'll just put the little device on. It won't hurt at all. There we go. Okay. This just measures the oxygen saturation in your blood and also your pulse rate. Okay, your pulse is a little elevated, but I would expect that as you're in a little bit of pain and not feeling well. Okay, but your oxygen sats are good, so that's fine. That's absolutely fine. Okay, that's perfect. Okay. Right. You've got no pain around your ears at all at the moment, have you? Okay. I'm just going to have a little look around your ear, if I may. Don't think there's going to be any problems here, but I might as well give you a good check while I'm having a look around. No pain there? That's good. That's good. Okay. No pain. That's wonderful. Right. I'm going to take a look down your ears, if that's okay. Let's write a couple of notes. Right, let's take a look down them. I'm sure they're fine. Right. So I'm just going to use the otoscope again, okay? And just pull up and back gently on each ear and gently insert the otoscope and have a little look around. Okay? Keep nice and still for me. Right, okay, so gently pulling up and back on the ear there. Is that okay for you, my lovely? Okay, and just inserting the otoscope. Okay, ear canal looks fine. Normal amount of earwax, that's fine. eardrum looks fine. Light reflex is normal. Structures behind eardrum are visible. That looks absolutely textbook perfect. Ear canal and eardrum. Okay. I'll just withdraw that now. There we go. You okay there? Good. Let's take a look at this side. Okay. Gently inserting that. Okay. Alright, ear canal looking good. No redness there. Normal eardrum presentation too. That's wonderful. Nothing to worry about there. Okay, I'll just withdraw that now very gently. Okay. Well done, that's all good. Okay. Right. I do need to do a couple of little tests. Okay. So I'm going to have to give you this COVID swab. Sorry. I know they're not the best. You've had these done before, haven't you? Yeah. Really, they should have given you one when you come in, but they didn't, did they? Which I have made a note of. So as you know how this works, I have to swab your nose, okay, and your throat, okay. I'll do your throat first, and then up your nose. I know, I'm sorry, it's not very nice. If you really can't tolerate the throat, just let me know, okay. Some people really struggle. If you're already feeling a little bit nauseous, it's not the best, okay. Just feel free to tell me. Alright, okay. Just got to do battle with opening this packet now. Sometimes they're not so easy. Okay. Oh. Okay, so can you open nice and wide for me? I'm just going to rub this round the back where your tonsils are, okay? Do say if it's uncomfortable. You may just gag a little bit, okay? Hopefully not. Nice and wide for me, okay? Right. Okay, and this side. Alright, and now up your nose. Okay, just insert this gently into your nostril there. That's perfect, and just move that round. Okay, and up to the nostril. Okay, well done. Well done. Just got to get that off there, and then just break that off. Pop that on there. There we go. There's so many sticky labels with these things. Okay. Just have to pop it into the bag. hold that on there. There we go. All done. Have to pull the sticky off. There we go. And fold that over. Right, that's that all done. Get that off. Let's mark off that that's all done. We have to mark off what we're doing now. Make sure that's all done. Okay. So I'll put your urine sample on the side here. Thanks for that. That looks healthy. But I need to check it. So just going to do a little dipstick check. How's your pain at the moment? You still okay? That's great. Okay. There we go. Having a good MOT today, aren't you? Okay. So let's just dip that in there. Make sure I get it all covered. Okay. Can get rid of that shortly. Right. Have to wait a minute for a couple of them to show up properly. Let's hope you match all the colours on the left there, because that's all the normal ones. Okay, let's just see. Yeah, alright. Let's just make sure. Okay. That's okay, a little bit of bilirubin showing there, but if you've got problems with your gallbladder or liver area, that could be why. I'm expecting there may be an elevated bilirubin in your blood as well. Okay, my lovely, that's not to worry about, we'll get that sorted for you. The rest of that urine sample I'll get checked by the laboratory, okay? I'll just put bilirubin. Okay. Right. I need to take a little bit of blood from you if that's okay, my lovely. Do you have any preference as to which arm? No? Okay. Well, shall we go with this side then? I'm just going to have to pop this tourniquet round your arm, okay? There we go. Pull that tight. Sorry, it's going to be uncomfortable for a little while. Okay. Now let's just see what we've got vein-wise. Oh, you've got good veins, haven't you? I haven't. They're terrible. I'm just going to give this little wipe before I go in there. Okay. All right then. Just get the needle ready. Okay, just going to feel a little sharp scratch while I take some blood from you, okay? Alright, keep your arm nice and still. Just clench that fist a little bit more. That's perfect. Okay, you ready? Okay, sharp scratch. There we go, that's wonderful. Just going to pop off that tourniquet now. Okay. There we go. Just need to change the bottle. Okay. That's wonderful. You okay? Feeling alright? Perfect. You're filling these up nice and quickly. I wish all my patients were like that. Okay, one more bottle change. Okay. Alright, that's perfect. Right, let's pull that out of there. Okay. Could you just hold this cotton wool on there with your other arm for me? That's wonderful. Keep that pressure on there for a little while. Okay, I'll just get these put into the packet. Okay. The label for that. Wonderful. Okay, so they can go with that swab and your urine there. Keep the lab busy today, won't we? Okay, let's just take a look at that cotton wool now. Right, just keep holding that on there for me. I'm just going to pop a little bit of tape over there. Keep that on for a little while, okay. This tape's really, really good. It's sticky, but it doesn't hurt when it comes off. Like some of them, I know, they're really painful, aren't they? So there we go. Keep that pressure nice and firm just for a second while I just cut this. Okay. Pop that there. That's perfect. And just a little bit more. There we go. How does that feel? Good, good, good. That all seems fine. Okay. Right. I'm just going to pop and grab the nurse over there because I can see she's got her trolley collecting samples. So I'll go and hand all your samples to her and I'll be back. Okay? Just rest a little while. Okay. Right, I'm back again. How are you feeling? Good, okay. As I said earlier, you'll get some more medication a little bit later. Okay. They know to come round and look after you. Alright. So now I'd just like to have a little palpate around your abdomen if that's okay. Now I want you to tell me if anything is uncomfortable. Alright. I'm expecting it will be in certain areas. Okay. I'll be very gentle. Alright then. So just breathe normally until I tell you otherwise. Okay. So I'm just going to have a little gentle palpate around. Is that sore there? Okay. How about here? Yeah, okay. Alright. Just round the side a little. Sore there? Okay. Just going to move a little bit further down the abdomen now and just gently press around. How does that feel? Yeah, okay. How does that feel? There, okay. A little bit sore in that area. Okay, my lovely. Okay. So I'm just going to press a little bit deeper this time. Alright, so it might feel a little bit more uncomfortable. Okay, but I'll be as quick as possible. Okay, so just going to go in just a little bit deeper. Okay. Okay, a bit sore there. Right, could you take a nice big deep breath in for me now? It's sore there, isn't it? Okay, yeah, that's fine. Alright. Breathe normally again. Okay. So now what I'm going to do is just gently tap, okay, around your abdomen. Okay. You're right there. Okay. Right. Okay. Actually, I'm going to just have a little listen just to your bowel sounds. Okay. Just going to press the stethoscope very gently on the lower part of your abdomen and just move around. Okay. Okay, good. Okay. That sounds good to me. There's no evidence of stasis, which means the bowel isn't moving. There's some bowel sounds going on in there, so that's okay. You've had no diarrhea or anything like that, have you? No, okay. Right. So when was the last time you had anything to eat or drink? Last night, okay. You've just got no appetite or anything, okay. Alright, well, it's going to be tomorrow before you'll be able to get surgery, okay, if that's what's needed, but I do feel you will need that surgery pending the scan this afternoon, but I do feel this is your gallbladder. Now, things can change very quickly if you get very, very severe pain happen all of a sudden, okay, or you start to feel very, very, very unwell all of a sudden. Obviously, you're in the right place now. But if you'd like some water, we can get you some water shortly, if that's all right for you. Yeah, I don't want you being without fluids. If you think you can drink water, if not, I'm going to pop you a cannula in and we can also give you some IV fluids. Okay. It's fine if you don't feel you can physically drink it at the moment. The IV fluids will keep you hydrated anyway, but you would be okay to drink a little bit of water for now. Yeah, but we will need you to be nil by mouth, obviously, prior to the surgery. Alright, okay, my lovely. So, have you had a cannula fitted before? Okay. So, this is the cannula. I'm going to place it in the back of your hands and it just allows us to pop medicines into there, okay, IV medicines. So it saves you having to swallow tablets or for us to inject you. They can all go through the cannula, Okay? All right. I think I'm going to pop it into your left hand, if I may. Okay. So let's give you a wipe. Just let down a nice wipe. They're nice and cool, aren't they? But that feels good as you're a little bit warm. We'll soon have you feeling better, my lovely. I know it's very, very unpleasant what you're experiencing, but you're in good hands and we'll take very good care of you. Okay, so I'm just going to pop the tourniquet around your arm again. Here. Okay. Alright, leave that there a second. Get that vein up. Right, let's have a look. You do have wonderful veins. Okay, so I'll be very, very gentle. You're going to feel a little bit of discomfort and a scratch as I pop this in, but once it's in place, it'll be fine. Okay, my lovely. You don't have to look. You can close your eyes, take some nice deep breaths. Okay, so I'm just going to pop that into your left hand now. Okay, very gently, sharp scratch now. Okay, there we go. Okay, that's perfect. And I just have to hold it in place with a very special dressing. Is that all right? Okay, so put that on there. Lovely. There we go. Very gently pop that around there. Let's just check that now. Okay. That's wonderful. So how are you feeling? Good, good. All right then. So, I'm done with you now. We're going to get you for the ultrasound scan this afternoon. Hopefully you shouldn't have to wait too much longer. And you'll do some meds in a little while, so the nurse will be in to sort that out. I am actually on shift for the rest of today. Okay, so I'm hoping I can get your results and I'll have a look at them. I'll have a look at the blood results. They'll be back very quickly. The urinalysis as well, and the COVID swab. We get them done very, very quickly for inpatients, of course. And the ultrasound scan, I shall do my best to grab hold of the radiologist and get them to have a look over the results with me so we get a good picture. So if you need that gallbladder removing, we can do that tomorrow for you. Okay, but I'm glad we can keep you in. Yeah, don't want you going home again and having to come back with the same thing. I think it's time for that to go, if that's definitely what the problem is. I think you've got gallstones which are actually filling up the gallbladder and blocking the bile duct, so therefore, nothing can flow through properly. It causes a lot of inflammation, a lot of pain. Okay, and the fever that you're getting as well. Okay, right then, so I'm going to go and leave you in the capable hands of our wonderful nurses for the short time being until you get your scan. Okay, I'm really hoping we can get that scan done in the next couple of hours. I may see you again later. I will come and give you the results when I've got them. Feel free to just doze off, do whatever makes you happy, okay? But do press your buzzer if you're not feeling well or you need some more medication, okay? And I'll get the nurse to put an IV fluid in for you as well, but we will bring you a little bit of water to drink. It's best if you stay off foods now anyway. I don't think you'd be able to tolerate them at the moment. All right then, my lovely. Okay, well, I'll be seeing you soon. You rest up a little while and I'll send the nurse in and we'll get that scan done shortly. Okay.